Myself is Keerthika, MSc Nursing, Department of Medical Surgical Nursing, E.S College of Nursing, Visalai. Now we start my presentation topic is conjunctivitis. Now we move on to the introduction of conjunctivitis. One of the most common ophthalmic complaint managed in the emergency department is conjunctivitis. A conjunctivitis is a common in childhood rather than adult and may be infectious or non-infectious. Most commonly conjunctivitis is due to bacterial infections, viral infections, allergic hypersensitivity. See this image anatomy of the eye. Next we move on to the anatomy of the eye. The outer coat which is transparent anteriorly is called the cornea. The white and opaque coat is the sclera. Next we move on to the definitions. Conjunctivitis is an inflammation of the membrane covering the surface of the eyeball. It can be result of infection or irritation of the eye. The inflammation of conjunctiva causes the eye's blood vessels to dilate, resulting in reddish appearance. Next we move on to the types of conjunctivitis. Types of conjunctivitis is bacterial conjunctivitis, viral conjunctivitis, allergic conjunctivitis. In bacterial conjunctivitis, there is a redness of the eye, edema is present and pus is present. In the viral conjunctivitis, redness of the eye and lacrimations. And then allergic conjunctivitis, edema, lacrimations and itching is present. See this image, healthy eyes. Next we move on to the according to the causes. So bacterial conjunctivitis is causes by bacteria. A viral conjunctivitis is common cold caused by adenovirus. So chlamydia conjunctivitis is caused by sexually transmitted infections. Allergic conjunctivitis is caused by pollen's dust. A reactive conjunctivitis is caused by chemicals such as swimming pools. It has different causes which include virus, bacteria, shampoos, dirt or smoke, chlorine and other foreign objects that invade the eye, allergy to dust of pollen or to contact lenses. Due to the etiological factors, there is a pathophysiology. Microbes enter into the eye or contact with infected object. It may lead to inflammation of the eye. It may lead due to a dilation of blood vessel of eye. It may lead due to a swelling, redness, exudate and discharge. Next we move on to the clinical manifestation. Redness of the eye is present. Increase the tears. Thick yellow discharge that when dries it crust over the eyelashes. Itchy eyes or burning sensations. Blood vision is present. Increase the sensitivity to light and brightness of sun. Redness in the eye and white of the eye in inner eyelid. A swollen conjunctiva is present. More tears than usual thick. Yellow discharge that crust over the eyelashes, especially after sleep. Green or white discharge from the eye, itchy eyes, burning eyes, blood visions. So those clinical manifestation is present in conjunctivitis. Next we move on to the diagnostic evaluation. The four main clinical features important to evaluate are the type of discharge, example watery, mucoid, purulent or mucopurulent. The type of conjunctival reactions are follicular or papillary, presence of pseudomembrane or true membrane, and presence of absence of lymph adenopathy, conjunctival epithelium in numerous projections that are usually seen as a fine mosaic pattern under a slit lamp examinations. Diagnosis is based on the distinctive characteristic of ocular sign, acute or chronic presentation and identification of any precipitating event. A positive result of swab, smear preparations and cultures confirm the diagnosis. Next we move on to the management. According to the medical management, a treatment is depend upon the types of conjunctivitis. To give a cold compressions, a bacteria is treated with antibiotics, quinolone in form of eye drops ointment or pills. Wear the spectacles to reduce the light sensitivity, discard the old pair of contact lenses and use a new one when conjunctivitis is gone. Allergic conjunctivitis is treated with corticosteroids. You should take a steroids drugs. Now to move on to the prevention of conjunctivitis is, do not touch with hands. So don't to touch the eyes too unnecessarily. Okay. Wash a hand often. Use a clean towel and wash cloth. You to use a separate cloth from yourselves. Do not share the towel or wash cloth to your families. Avoid swimming in your swimming pool. Do not share your eye, cosmetic or personal eye care items. Use any antibiotic or complete period prescribed. Nursing diagnosis for conjunctivitis. As acute pain is related to inflammation of conjunctiva. As anxiety is related to a lack of knowledge about the disease process. A risk of spread of infections associated with inflammatory process. Impaired self-concept, body image degrees related to change of the eyelids, swelling and edema. A risk of injury is related to limited visions. Now I summarize my topic. We have discussed about the anatomy and physiology of eye, definitions, etiology, types, pathophysiology, clinical manifestation, diagnostic test and management. Now we concluded my topic. Conjunctivitis is a common eye inflammation that typically resolves with proper care. But its conclusion is varies by type. Viral conjunctivitis is often self-limiting cleaning in 7 to 14 days, while bacterial cases usually improves within 2 to 5 days with antibiotic eye drops. Thank you.